Welcome to Ehrlichion's Bloodborne Pathogen Training. In this session, we will discuss how you might be exposed to bodily fluids in the workplace, how you can protect yourself from exposure, how to clean up bodily fluids, how to manage contaminated waste, and your right to medical evaluations. Bloodborne pathogens are infectious microorganisms in human blood that can cause disease in humans. These pathogens include, but are not limited to, hepatitis B, hepatitis C, and human immunodeficiency virus, or HIV. Needle sticks and other sharps-related injuries may expose workers to bloodborne pathogens. Workers in many occupations, including first responders, housekeeping personnel in some industries, nurses and other healthcare personnel, all may be at risk for exposure to bloodborne pathogens. Over the years, there have been many outbreaks of disease around the world. Three examples of outbreaks that have affected the U.S. include the 1981 outbreak of HIV, the 2014 outbreak of Ebola, and most recently, the 2016 outbreak of the Zika virus. All three are examples of diseases that can spread through contact with infected blood or other bodily fluids. The CDC estimates that 5.6 million workers in the healthcare industry and other related occupations are at risk of occupational exposure to bloodborne pathogens, including HIV, hepatitis B, and hepatitis C. All occupational exposure to blood or other potentially infectious material places workers at risk for infection from bloodborne pathogens. A vaccination for hepatitis B, or HBV, has been around since 1982. Approximately 1 to 1.25 million Americans are chronically infected, with symptoms including jaundice, fatigue, abdominal pains, loss of appetite, intermediate nausea, and vomiting. HBV may lead to chronic liver disease, liver cancer, and even death. It's important to remember that HBV can survive for at least 1 week in dried blood. An estimated 3.9 million Americans have been infected with hepatitis C, or HCV, of whom 2.9 million are chronically infected. People chronically infected with HCV may not be aware of it because they are not clinically ill. Sometimes it can take 2 decades before symptoms are recognized. Chronic liver disease occurs in about 70% of infected people. 8 to 10,000 deaths occur each year as a result of chronic liver disease. There are some drugs that have been licensed for treatment of HCV. However, they are only effective in 10 to 40% of people. Human immunodeficiency virus, or HIV, causes acquired immunodeficiency syndrome, or AIDS. AIDS attacks the immune system cells, weakening and eventually destroying the immune system, and thus leaving the body at a higher risk of developing more serious conditions such as pneumonia or cancer. It is estimated that more than 1.1 million people are living with HIV. Close to 1 in 5 are unaware that they are infected. Once infected, the human body cannot get rid of the HIV virus completely. So once you have it, you are infected for life. Some people experience flu-like symptoms 2 to 4 weeks after infection, while others may not feel sick. HIV does not survive long and cannot reproduce outside the human host. This is a list of other bloodborne diseases caused by viruses or bacteria. These circulate in the blood for prolonged periods during at least one phase and therefore are capable of being transmitted through blood or other potentially infected materials. However, most of these are rare in the United States. The bodily fluids that you are most likely to encounter in the general industrial workplace are blood, saliva, vomit, or urine. If blood is not present in the bodily fluid, bloodborne pathogens cannot be present. Remember, sometimes the blood may be present in microscopic quantities and be difficult to see with the naked eye. To be safe, you must assume that all bodily fluids are contaminated with infectious blood. This is called the universal precaution, which we will discuss further later. Bloodborne pathogens can only be transmitted to you if you physically make contact with an infected person's blood or bodily fluids containing blood. Even then, your healthy skin is an excellent barrier to protect yourself from bloodborne pathogens. The contaminated blood or bodily fluids can enter your body through mucous membranes such as your eyes, mouth, or nose. If your skin is not intact at the point of contact with the contaminated blood or bodily fluids, the bloodborne pathogens could potentially be transmitted. Examples of non-intact skin include dermatitis, hangnails, cuts, abrasions, acne. Obviously, a contaminated sharp such as a needle or broken glass could potentially transmit bloodborne pathogens because of the penetration of the skin. The bloodborne pathogen standard requires employees to identify the jobs, tasks, and activities that could expose employees to potentially infected blood or bodily fluids. Exposure could occur when near someone who is involved in an industrial accident. Obviously, when administering first aid to someone who is bleeding, you are potentially exposed. Employees expected to clean up work surfaces, equipment, or machinery after an accident are also potentially exposed. Janitorial workers are potentially exposed when cleaning up urine, vomit, sanitary napkins, etc. Maintenance workers might be potentially exposed when repairing the plumbing of toilets. The OSHA bloodborne pathogen standard requires us to have a written exposure control plan. Ours is SOP 97. The goal of SOP 97 is to identify potential exposure and define work practices for preventing exposures. The exposure control plan addresses many elements, all of which we will discuss in this training session. You can find our SOP 97 on the SC1 file. OSHA defines universal precautions as an approach to infection control. According to the concept of universal precautions, all human blood and certain human bodily fluids are treated as known to be infectious for HIV or other bloodborne pathogens. The appropriate precautionary methods will enable a worker to avoid contact with infectious material. By avoiding contact, there is no exposure, thus we can avoid contracting a bloodborne disease. Universal precautions protect individuals who are directly involved with the cleanup process and who will possibly be in contact with the spill of bodily fluids. Always wear appropriate PPE when handling any type of bodily fluid. Universal precautions require adequate cleanup and decontamination of yourself, equipment, and tools. Always wash your hands after handling any type of bodily fluid, even when wearing gloves. PPE is a vital part of preventing potential exposure. Bloodborne pathogen kits are located above all first aid stations. As all first aid responders know, universal precautions are required. Protect yourself first. For normal bleeding, gloves are required. Work gloves, rags, plastic, or even paper will work as a barrier if latex gloves are not available. The point is to use something as a barrier between your skin and the victim's blood or bodily fluids. An important part of preventing exposure to bloodborne pathogens is proper decontamination and cleanup. With all bodily fluids, assume contamination and wear protective gloves. Latex gloves can be found in all first aid kits. The bodily fluid disposal kits contains fluid cleanup materials such as absorbent powder, a disinfectant solution, and a disposal bag. The powder can be sprinkled on liquid bodily fluids such as blood. When the powder absorbs the fluid, it can be scooped up and placed into the disposal bag. If no disinfectant solution is available, it can be substituted with the solution of 10% bleach. Dispose of all contaminated items such as gloves, towels, rags, and absorbent powder. Place it all in the disposal bag. We will discuss how to manage bio-waste shortly. These are some common sense safe work practices that will help prevent exposure. Remove contaminated clothing or PPE as soon as possible. If blood were to splash onto your shoes, pants, or shirt, remove those items as soon as possible. Wash your skin in the area underneath the clothing that was contaminated with bodily fluids. Remove contaminated PPE such as gloves as soon as you are done administering first aid or decontaminating equipment or work surfaces. Cleaning tools, work surfaces, or equipment will prevent the next user from unknowingly coming into contact with potentially infected bodily fluids. Thoroughly wash your hands, face, and any other area of your skin that may have come in contact with bodily fluids. If you believe that blood or other potentially contaminated bodily fluids was splashed into your eyes, immediately go to the emergency eye wash station and flush your eyes. Properly disposing of contaminated items in appropriately labeled bags or containers will help prevent someone from accidentally being exposed. At Ehrlichon, we do not generate regulated medical waste. These are contaminated items that would release blood or other potentially infectious material when compressed. Waste from an incident cleanup using one of our bloodborne pathogen cleanup kits can go into the compactor dumpster. The hepatitis B vaccination is offered to all potentially exposed employees, which is our first responder team. It is provided at no cost to the employee and can be obtained at most medical facilities. It is important that if you choose not to receive the vaccination that you submit a declination form or our HSE-FO-447.3 vaccination waiver. Likewise, it is important if you've already had the vaccination to provide HSE with the proper documentation. An exposure incident is a specific incident of contact with potentially infectious bodily fluids. If there was no infiltration of mucous membrane or open skin surfaces, it is not considered an occupational exposure. If an employee administering first aid or normal bleeding is wearing the appropriate gloves, then an exposure incident does not exist. Be sure to report all incidents involving blood or bodily fluids so that we can determine if an exposure occurred and then offer post-exposure medical evaluations if necessary. If the source individual gives consent, the evaluation includes testing of his or her blood. The results of such testing are provided by the medical personnel to both the source individual and the exposed individual. The post-exposure medical evaluation is designed to help determine if the person was exposed to infected bodily fluids. The medical evaluation is completely confidential for both the exposed person and the source person. Not even the company will know the results of such testing. The evaluation will document the route of exposure and will identify the source individual. Medical records are kept confidential. However, they are available to each employee upon request. The records will include your hepatitis B vaccination status, any post-exposure evaluation and follow-up results, and any written opinion or other specific information provided by the healthcare professionals. Training records include today's date, content of today's training, and of course, your name. Remember to assume that all blood or bodily fluids are infected with bloodborne pathogens such as HIV or hepatitis B. Wear the appropriate PPE as a barrier to prevent the transmission of bloodborne pathogens and use safe work practices such as labeling and proper disposal. Decontaminate yourself by thoroughly washing up and washing any contaminated equipment or tools. Report all incidents involving bodily fluids so they can be evaluated for potential exposures. That completes the presentation portion of the bloodborne pathogen training. To finish the training, you must pass the quiz by scoring an 80 or better.